Do you know what an ectopic pregnancy is? It's different from a normal pregnancy. In a regular pregnancy, a fertilized egg travels from the ovary down the fallopian tube and implants itself in the uterus. However, in an ectopic pregnancy, the journey of the fertilized egg takes an unexpected turn. The egg, instead of reaching its intended destination, the uterus, implants and grows outside the main cavity of the uterus. The most common site for an ectopic pregnancy is within a fallopian tube, the very channel that carries eggs from the ovaries to the uterus. That's why oftentimes when we talk about ectopic pregnancies, we're referring to what's known as a tubal pregnancy. But it's important to note that ectopic pregnancies can also occur in other locations like the ovary, abdominal cavity, or the lower part of the uterus near the cervix, though these are much less common. Nowadays, ectopic pregnancies are becoming increasingly common, and it's crucial to shed light on this topic because it poses significant health risks if not identified and treated promptly. The reasons behind why an ectopic pregnancy occurs are multifaceted. In many cases, it could be due to infection-related issues in women such as urinary infections, vaginal infections, or a high rate of white discharge. Other contributing factors may include problems with the fallopian tube such as blockages or damage, issues with the movement of the eggs, or sexually transmitted infections. All of these factors increase the chances of a tubal pregnancy. Symptoms of an ectopic pregnancy can vary. The first sign could be a missed or irregular period. Then there might be abdominal pain, typically felt low down on one side. Vaginal bleeding or brown watery discharge may also occur. Sometimes it may present as severe stomach pain. The location of the pregnancy is what makes it ectopic and potentially harmful. It's key to be aware of this condition because if left untreated, it can cause major internal bleeding and even be life-threatening. But with early detection and proper management, many women can safely navigate through an ectopic pregnancy. What causes an ectopic pregnancy? There are a few main culprits. First, let's delve into infection-related issues. Various infections in women can contribute to the occurrence of an ectopic pregnancy. These include urinary infections and vaginal infections, which create an unfavorable environment for a fertilized egg to implant in the uterus. High rates of white discharge can also be a warning sign, as this often indicates an ongoing infection. Moving on, we have issues with the fallopian tubes. You see, these tubes act as the bridge that carries eggs from the ovaries to the uterus. However, sometimes, due to various reasons, the eggs may not move as they should. Instead of making their way into the uterus, they may get stuck in the tubes, leading to what we call a tubal pregnancy. Now, what could cause these issues with the fallopian tubes? Well, one factor could be blocks in the tubes. These blocks could be due to various reasons such as scar tissue from a previous surgery or infection, or even from a birth defect. When the fallopian tubes are blocked, the egg can't move down to the uterus, and it may implant itself in the tube instead. Sexually transmitted infections also play a significant role. Infections such as chlamydia and gonorrhea can cause inflammation and scarring of the fallopian tubes, again leading to blockages that prevent the egg from reaching the uterus. It's important to note that while these are common causes, an ectopic pregnancy can occur even if none of these factors are present. Sometimes the cause remains unknown. It's a complex condition with a myriad of potential triggers. To sum it all up, urinary and vaginal infections, issues with the fallopian tubes, blockages, and sexually transmitted infections are just some of the factors that can increase the risk of an ectopic pregnancy. Understanding these causes and recognizing the signs can be vital in managing this condition effectively. These are just a few of the factors that can increase the risk of an ectopic pregnancy. Are there signs to look out for that might suggest an ectopic pregnancy? The answer is yes, and today, we're going to delve into the symptoms of this condition. Ectopic pregnancy, while not the norm, is a reality for many women. It's a situation where a fertilized egg begins to grow outside the uterus, most commonly in the fallopian tube. This is why it's often referred to as a tubal pregnancy. Now let's talk about the signs that might indicate an ectopic pregnancy. The symptoms can be subtle and sometimes they may mimic those of a normal pregnancy or even a menstrual cycle. One of the first symptoms you might notice is a missed period or irregular periods. This is a common sign of pregnancy, but when coupled with other symptoms, it could point towards an ectopic pregnancy. Another symptom to watch out for is abdominal pain. This isn't the mild discomfort associated with a regular period. It's a sharper, more concentrated pain that typically occurs low down on one side of your tummy. This pain can range from a dull ache to a severe, sharp, and persistent pain. Vaginal bleeding or a brown water-like discharge is yet another symptom. This bleeding might be different from your regular period. It could be lighter, heavier, or sporadic, and sometimes ectopic pregnancy can hit like a wave of intense, heavy stomach pain. This is a severe symptom and might indicate that the fallopian tube has ruptured. If you experience this, it's crucial to seek immediate medical attention. Please remember, these symptoms can vary in intensity and frequency from woman to woman. Some women might experience all of them, while others might only notice one or two. These symptoms can be alarming, and it's crucial to seek medical attention if they occur. Understanding the signs of an ectopic pregnancy can help in early detection and management, potentially saving lives. Remember, your health is paramount, and taking care of it should always be a priority. An untreated ectopic pregnancy can lead to serious complications. This is a statement we can't stress enough. The risks of ectopic pregnancies or tubal pregnancies, as they're often called, are indeed grave and can be life-threatening. So, how can we treat an ectopic pregnancy? Let's dive right into it. Ectopic pregnancies, while often a cause for concern, can be managed through various treatment avenues. The appropriate course of action largely depends on the stage at which the ectopic pregnancy is detected. One of the first lines of defense is medical management. This involves the use of a medicine called methotrexate. Methotrexate is a potent substance that halts the growth of the pregnancy. This treatment is typically administered in the early stages of an ectopic pregnancy before any complications arise. Methotrexate works by inhibiting the growth of rapidly dividing cells, like those of the fertilized egg. It's usually administered as a single injection and can be a highly effective way to manage an ectopic pregnancy without invasive surgery. However, this method does require careful monitoring, and follow-up appointments are essential to ensure the treatment has been successful. In more complicated scenarios, where the ectopic pregnancy is causing severe discomfort or poses a significant risk to the woman's health, emergency surgery may be required. This surgery typically involves the removal of the affected fallopian tube. While this may sound daunting, it's crucial to remember that this is a well-established procedure and is often the safest option in such situations. However, it's important to note that not all ectopic pregnancies require active intervention. In some cases, ectopic pregnancies do not rupture and may resolve on their own without treatment. This is particularly likely if the ectopic pregnancy is detected very early and is carefully monitored. In all instances, though, it's vital to consult with a healthcare professional who can provide the appropriate guidance based on your specific circumstances. Sometimes, ectopic pregnancies do not rupture and clear without treatment, but it's always best to consult with a healthcare professional. Remember, each situation is unique, and what works best for one person may not be the best course of action for another. Your health and well-being are paramount, and getting the right advice is the first step in navigating this journey.